Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. A novel coronavirus is a new strain that has not been previously identified in humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Virus replicates in the human beings and can produce active or latent disease. Common signs of infection include respiratory symptoms like fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Diagnosis is made on the basis of laboratory tests on respiratory specimens and serum to detect human coronaviruses. Laboratory testing is more likely to be used if you have severe disease or are suspected of having MERS. There are no specific treatments for illnesses caused by human coronaviruses. Most people with common human coronavirus illness will recover on their own. However, you can do some things to relieve your symptoms. For example, take pain and fever medications, use a room humidifier, or take a hot shower to help ease a sore throat and cough. If you are mildly sick, you should drink plenty of liquids, stay at home and rest. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs, and avoid close contact with anyone showing symptoms of respiratory illnesses such as coughing and sneezing. Watch the detailed lecture on sqadia.com infectious medicine course. That's 2 minutes. See you in the next video.